When you have a bariatric patient who gets pregnant, what are some of our concerns? Okay. Well, we know that babies need good nutrition and good vitamin supplementations for healthy growth. We know that the most important part of fetal development is in the first 6 to 8 weeks. So what we recommend is bariatric patients wait 12 months, but more 18 months for bariatric surgery, okay, to ensure good nutrition before getting pregnant, okay? We know that fertility improves pretty drastically after bariatric surgery, so all these patients are instructed to be on birth control after surgery. And what we see is once nutritional and vitamin levels are addressed, pregnancy for bariatric patients usually is a very positive thing. Also, what we see is bariatric surgery outcomes for infertility slowly improves, comparable to that of the never obese population. So it really does help with fertility. Again, multifactorial, a lot of different things, but we know that reducing weight does help. Okay. What we do know is that babies who are born to bariatric mothers are slightly smaller, okay, and they're born slightly earlier than the never obese mothers, okay. But mothers also endorse a better fertility after bariatric surgery, but it also endorse improved engagement and physical activity with their children at a younger age. During pregnancy, we see appropriate food capacity. They're able to eat, okay, and gain the weight. And babies are good parasites, if I can say that. So babies get what babies need, okay? So the most important thing is to ensure good maternal nutrition, okay? So preoperative, waiting a certain amount of time, make sure optimizing, checking preoperative nutritional levels, all very important for the bariatric patients. We also see that usually extra interval ultrasounds to look at growth patterns of the baby is performed for bariatric patients. And the universal experience is that bariatric mothers gain less weight than obese mothers who undergo pregnancy. They gain less weight. So what are some of the expected concerns we have centering around pregnancy and bariatric surgery? Well, fetal growth is one, vitamin supplementation, and gestational diabetes testing. What we know is that fetal growth is usually normal. Sometimes the fetus is a little bit small. Again, interval ultrasound to look at fetal growth is usually performed. How about vitamin supplementations? And that's a common question I have. So the bariatric vitamins are really kind of very well formulated, and we have a lot of pharmaceutical companies looking. As the field has grown to about 300,000 cases per year, there's a lot of pharmaceutical industries now as these patients are committed to lifelong vitamin supplements, really good vitamin supplementation. So what we see is bariatric vitamins are sufficient for all the pregnancy needs, okay? But we also know that prenatal vitamins is sufficient for bariatric patients as well. So preoperative optimization and compliance with vitamin supplementations, good quality vitamin supplementation is what we recommend. How about diabetes testing in these bariatric patients? Well, obviously some of these patients can't tolerate lots of volume and they can't tolerate a hard carb load, and especially gastric bypass patients. So these oral glucose tolerance tests are really sometimes discouraged. So other methods are used, and sometimes serial hemoglobin A1C testing, home glucose monitoring, and we have this continuous glucose monitoring now where patients know exactly what's happening every kind of bite they take and every step they move. So these are some of the things we can work around with these bariatric patients and diabetic testing during pregnancy.